Welcome to Successful Living with Bill Knapik. Every week we talk with interesting people in a variety of professions, and along the way, get ideas to enhance success in all categories of your life. Successful Living with Bill Knapik starts right now. And here's your host, Bill Knapik.
Welcome to the show, Successful Living with Bill Knapik, and today on location at the J. Flowers Health Institute, and we are with Dr. James Flowers right here. Dr. Flowers, welcome to the show.
Bill, thank you so much for coming by. I'm so happy to have you in the office and actually do a show here in the office with you, so thanks.
That is correct. We are here on location, and you are in a tremendous location in Houston, Texas, to serve your clients from around the world, and certainly right here in Houston. In case people missed our last episode, let's tell them about the J. Flowers Health Institute.
You bet. So first of all, Bill, I guess we're located here right in the River Oaks area, 4400 Post Oak Parkway, right at 610 in San Felipe, catty corner to the St. Regis. Beautiful, comfortable building, very spacious. You know, we have clients that fly in from all over the world for something that we call a comprehensive diagnostic evaluation. And you ask, what does that mean? What is a comprehensive diagnostic evaluation? The patients that we typically see are patients that are having difficulty in life, really understanding the depth or severity of their problem. And many times, Bill, they don't even know what their problem is. Maybe they might be in denial. Maybe they've been to many academic institutions or hospitals and physicians around the country or even the world looking for answers for their medical problems, their mental health problems, their emotional problems. During times of COVID, things that are going on with their marriage, they don't know how to solve their problems. So what we do is we evaluate what I call 360 degrees of a person's life, from psychiatrically, psychologically, diagnostic testing, nutritional testing, physical therapy, really every area and every angle of a person's life. And the goal of that diagnostic evaluation is to come up with a concrete set of proper, true diagnoses with a roadmap for treatment and where to go, recommendations for treatment, recommendations for successful living, recommendations on how to thrive in life and move forward in life and leave behind all the gunk and problems and move forward in a healthy, thriving way.
Sometimes in our lives, and I suppose everybody, when you say they may not know that there's something wrong, sometimes as we go through life, we have that point in life where something doesn't seem right. That sounds like the perfect time to get the comprehensive diagnostic evaluation right here. And today we do have a special topic we want to talk about in addition to the all-around comprehensive checkout for people around the world, anywhere. You also treat your history. You have an expertise like none other in terms of treating addiction. So we're going to talk about addictions a little bit today, and that covers so many things. I think the first thing is, as a doctor, how do you describe an addiction?
Sure. So, we can be addicted to practically anything. We can be addicted to alcohol. We can be addicted to drugs, street drugs, prescription drugs. We can have process addictions like gambling addictions. We can have a sex addiction. There are many, many, many addictions. Bill, you can even have an exercise addiction, right? Eating disorders. Right. And when you ask what is an addiction is really something when it affects our behavior and it affects other people. In other words, we're not able to perform at work. We're not able to perform in life. We're not able to perform in our marriage or interpersonal relationships. And when it starts causing harm, we're not able to get out of bed in the morning, or we only focus on that particular, let's just use alcoholism. We only focus on when can I get my next drink, right? That's when we see addiction. That's when we see it, but it starts even way before we see it.
It almost sounds like during the day, we talk a lot to ourselves. Our inner voice is what we hear all the time. So what you're saying in the case of alcohol addiction, it sounds like when we think about alcohol, perhaps throughout the day, when's the next drink, there is a warning sign, a red flag.
Absolutely. I'll tell you, you would be surprised. I don't know the exact number or the exact percentage, but you would be amazed at the number of patients that I see that will disclose to us and eventually disclose to their family that they've been carrying a flask or a thermos to work with vodka with some particular alcohol in it. And they'll sip on it throughout the day, because if they don't sip on it throughout the day, many times they'll start to have sweats, they'll start to have tremors, and that really shows a true physical and psychological addiction to that alcohol that they're drinking. And if they don't sip on it during the day, they have a physical reaction and begin to sweat and go into withdrawal. So it is not infrequent that we see high performing individuals that are functioning alcoholics, but nonetheless alcoholics, and need to have that drink and focus on, even before going into a meeting, they'll want to take a big drink of their vodka or whatever drink that is before they walk into a meeting, and then chew a piece of gum and try to hide that.
The first thing that comes to mind is we hear the term all things in moderation.
Yeah.
So how much is that at play? And we're talking about alcoholism right now, many addictions, as you stated. Is alcohol addiction the most common one? Let's say we want to enjoy a glass of wine or even a mixed drink or a beer. How do we know when it's too many? Is 2 drinks, 3 drinks?
It's a great question. Is alcohol the most common one? Probably the most common addiction. But I would say that, again, addictions are often hidden before we see them. And all types of addiction are extremely prevalent in our society. And we don't always pick up on it. Loved ones don't always pick up on it up front. They need to look for signs of addiction. But the number of drinks, we're focusing on alcohol right now. There are some people who can go out to dinner and have 2 or 3 cocktails at dinner, right? Or go to a party or go to a social event and have 1, 2, 3, and then put it down and go home. And then there's a subset of people in our population that just can't stop at 1, 2, or 3, right? Oftentimes people will tell me, I am not in recovery. Myself, my entire family either is in recovery or should be in recovery. I'm a very grateful adult child of alcoholics, but not in recovery. And I can go to dinner. Most of my friends, by the way, because I live in this world, are in recovery. And I can go to dinner and have a glass of wine and leave maybe about 10% of it or a quarter of it, maybe in a glass of wine, and get up and leave the restaurant. You'd be amazed at how many times people say, you're not going to finish that glass of wine.
I would be one of those people like, hey,
yeah,
it's expensive.
It is. It is expensive. It is. But I'm able to have whatever amount of wine in moderation that I like, 1 glass or 2 glasses, and put that down and walk away from the table. There is a lot of people in our society that just cannot stop at 1 or 2 glasses of wine, that need that wine to really even sometimes think clearly, to have a conversation, to ease their stress, to sleep at night, but don't really see all the medical and side effects of it.
Before we leave alcoholism, as an example of addiction, as we talk about addiction, when someone calls you up for your help, even prior to founding the J. Flowers Health Institute, what do you hear? What are the things where they reach out and say to you, hey, this has become a problem? What does that paragraph sound like when they submit and say, hey, I really need help? I'm calling you, help me.
Well, the interesting thing is I would say 95% of the time, it's a loved one calling. Rarely does the alcoholic pick up the phone and ask for help. Occasionally they do, right? The untreated alcoholic. But many times it's a husband, a wife, a child, a son, a mother, a father, someone in the family that's saying, my husband needs some help and here's what's going on. So what we do is talk and say, tell me about the problem. Tell me what you see. And it's some of the same things that we talked about. I treated a woman who about 2 years ago, her husband called and said, listen, my wife wakes up in the morning and pops a cork on a bottle of Cabernet and starts drinking. And I go to work, and when I come home, she's still sipping, and she's on her 3rd or 4th bottle and unable to function. And that woman, by the way, was treated. We sent her to a treatment center outside of the state of Texas. She was there for 90 days. She came home. She was home for 2 days and relapsed. Went back into treatment for 60 days, came home, relapsed again. Went back into treatment for another 60 or 90 days, came home and lasted about a month and relapsed again. And that woman was a chronic, long-term alcoholic. And she went into a treatment program that addressed the alcoholism, but did not address the comorbid, what we call comorbid mental health and trauma that she had experienced. And she had never disclosed to her husband that she had been raped prior to getting married 3 times in her life. And every time they were intimate with each other, that trauma was brought up. And the only way that she could cope with that was with alcohol. And she didn't know how to tell him. And so we see that. We see problems at work. We see people not able to get up and get out of bed and go to work. We see people not able to go to their classes in college, things like that.
Well, that sounds like a severe case indeed, and also the underlying issue that was there. When you successfully help someone in a severe case like that, in effect, you're giving someone their life back. And not only their life, as you mentioned, their loved ones. So as far as giving hope to people out there, there is life on the other side if you tackle the addiction in the proper way, and that's what you do.
There is an absolutely amazing life on the other side of any addiction, right? You can be a severe alcoholic, you can be a street drug addict, you can be a homeless drug addict, you can be anyone in the world and have a severe addiction. And seeking help for treatment is the answer. Not seeking help, you're going to stay in that same dysfunctional insanity, right? But what you want to do is reach out to a loved one, reach out to a treatment center, make a phone call, interview that treatment center, call us at J Flowers Health. Talk to us about your problems. We can help you find the right treatment center. But you bet you can have a better life than you've ever dreamed of by going through a treatment program. Not everyone needs residential care. Some people need outpatient care. Some people need detox. Some people, there's different levels of care. The highest level of care is medical detox, where you're actually detoxing your body safely under the supervision of a nurse and a physician and a healthcare team while your body is clearing the alcohol. The two most dangerous detoxes in the world are alcohol detox and benzo, which is Xanax and Valium, things like that. A detox on your own with alcohol can absolutely kill you, meaning you will have seizures and you can die from those seizures, severe seizures. Also from a benzodiazepine like Xanax, you can have a severe seizure and die from that. So you really want to focus on going to the proper medical treatment program and looking for help, looking for the right medical team and the right addiction team to help you detox safely. Then you step down typically into what we call a 45-day residential program. And then you step down into something we call partial hospitalization, which is about 6 hours a day, 5 days a week. Then you do another step down of 3 hours a day, 3 days a week. And then you step down to outpatient counseling once a week. And throughout this time, you have an individual counselor and you have a sponsor. And if you have a sponsor, you continue to do therapy outpatient, do maybe some sober living for a while, meaning you live in a structured environment with other men or other women of similar interests and similar ages. That is a structured environment that helps support you while you're continuing your early path to recovery. So not everybody needs all of that, but in a severe case, it's really important to have all levels of care.
We're talking with Dr. J Flowers with the J Flowers Health Institute. He is the founder. Dr. Flowers, let's tell people the website.
You bet. jflowershealth.com, www.jflowershealth.com.
In addition, helping people where they can subscribe to your podcast, too, you now have at least one podcast. You're doing a podcast per week, Understanding the Human Condition.
Yes, that's right. Understanding the Human Condition. That's exactly right.
So people can seek that out. In fact, on your first episode that I heard with the wonderful Robin French, one of my friends, and your associate here,
yes,
people hear your actual story. That was incredible. So if they want to know your story and so much more, Understanding the Human Condition.
That's
the
right.
podcast. You can hear more of Dr. Flowers every week. Download, subscribe, and all that. We talked about alcohol addiction.
Yeah.
What is another addiction? And are there trends that you see? Like everything else, I would think there's trends, but what is another addiction that you treat with some regularity?
You bet. My core clinical specialty is working with someone with chronic pain syndrome, meaning acute pain is when you step off a curb and you sprain an ankle and it hurts and you go to the doctor and they do an x-ray and they say, well, you sprained your ankle. That's acute pain, and it's typically going to resolve. 90% of the time it'll resolve within a week or two. Chronic pain is really when you have severe pain or even mild pain that lasts longer than 90 days. Our bodies are designed, I believe by God, to heal themselves or with the help of medicine within about a 90-day to 120-day time period, whatever the injury is, whether it's a gunshot wound, whether it's a surgical procedure, whatever that is, we should heal in about 90 to 120 days. When it doesn't heal, we go into something called chronic pain. That means you have ongoing pain that's become a chronic condition. And oftentimes your doctor, you go to the family practice doctor and you say, I hurt, my back hurts, I fell off a ladder, and he writes you a prescription, sometimes for Vicodin, sometimes Vicodin, hydrocodone, same thing. Or sometimes you say, I can't sleep because of my back, and they'll write you a prescription for a Xanax or something like that to help you sleep. Worst possible thing that can be done. The number one prescriber of opiates, by the way, in the United States are family practitioners. Family practitioners, nothing against family practitioners. I love my family practitioner, who is absolutely amazing. I've used him for 20 years as my physician, but in general, across the population, family physicians write more prescriptions for opiates and benzodiazepines than a pain doctor, more so than a neurosurgeon, more prescriptions for pain meds than a neurosurgeon. And it's the number two doctor. Do you know what the number two doctor is writing the most pain prescriptions? Who would you think it would be? A dentist.
Oh, there you go.
A dentist writes the second most amount of narcotics to patients. So many times what happens is pain is completely subjective. We all experience pain differently. Women experience pain during labor and tolerate higher levels of pain generally than men. Sometimes we become weekend warriors. We hurt our back. We sprain our back. We fall off a ladder. Women do exactly the same thing. And we go to our doctor and he writes a prescription. 30 days later, you go back to the doctor and he typically says, why don't you do some physical therapy? Well, physical therapy doesn't always feel good. And you kind of stop doing physical therapy and you go back and you say, I still hurt. And he says, well, I'll refill it again. He gives you another prescription for some Xanax, 0.5 milligram probably, and he'll give you a prescription for Vicodin. And during that second month, your brain is changing and the chemicals in your body are changing, and it's going, oh, I like this. This makes me feel better. My pain is gone. But what you don't realize is your body is actually becoming dependent on it, and it's binding to the neurons in your body and your brain, and you're becoming physically addicted.
It's like having a house guest, and you're adjusting to that guest, and in this case, it's not so good.
That is exactly right. Yeah. Oxycontin, oxycodone were FDA approved for long-term cancer pain, not short-term chronic pain. And again, it's two of the most prescribed, hydrocodone and then Oxycontin and oxycodone, hydromorphone, are some of the most overprescribed medications in the world. Now we're seeing huge lawsuits, but it all started back in the 90s, well, pre-90s, but in the 90s, the United States government said this is the decade of pain. And an accreditation agency called Joint Commission told hospital systems and physicians, you must address pain adequately. Not should, but you must address pain adequately. And when they said that, they also said, if you do not treat pain adequately, you will lose your licensure and your ability to bill Medicare. And hospital systems depend on Medicare. So Pandora's box was opened. And any time you walk into a ER or walk into a hospital room, you see a chart on the wall, and it says, what is your pain today? From 0 to 10. Smiley face to crying face. And anytime pain was rated more than a 5, the doctor would write an order for some Vicodin or some other medication. That was the decade that we had the explosion of pain medication, was the 90s. And then a family who owned a company called Purdue Pharma decided to develop a drug called Oxycontin. They spent $250 million launching the product, and they went to every physician practice in the United States, took them on trips to Hawaii, took them to Jamaica, took them all over the world on trips, and said, this is a non-addictive pain medication. It helps patients, and we'll take you on more trips the more you write. And that is just the fact, and it's the way it happened. And so many people, we are still in the middle of an opiate epidemic in this country. During the year of COVID, it's gone kind of by the wayside, and people are so focused on COVID right now. We are in the middle of another pandemic, and it's called the opiate pandemic.
So we want to remind people, if you're out there listening, if you have a problem with some kind of addiction of any sort, even exercise, as you mentioned, you can reach out to the J. Flowers Health Institute. If you have a loved one that you see some of the warning signs, some of the red flags, jflowershealth.com. You can seek help here, no doubt about it, right here in Houston, Texas. If you're listening outside of Houston, same thing, jflowershealth.com. Of course, you can hear Dr. Flowers now on a weekly podcast called Understanding the Human Condition. That's a great name, by the way.
Thank you so much.
So that's great. I can't wait for episode number 2. Also, as we have a few minutes left in the segment, what else would you like people to know about addiction? There is hope. I think that's so important. What else should they know?
You know, I think that hope is the number one thing I want people to know, is that no matter where you are in your life, no matter how depressed you are, no matter how sad you are, no matter how big the hurdle and the wall feels in front of you, that if you put your mind to it and you can visualize it and you can see yourself on the other side of that wall, the other side of that hill, then you can climb any mountain and you can climb any hill in the world. And I'm really an example of that. Like I said, I happen to not be in recovery, but boy, have I had my as you know me at this point, I've had a significant amount of trauma and a significant amount of family members in addiction and active addiction and recovery and in and out of recovery in my life, and grew up in a home full of trauma, and I overcame a lot of that. And if I can do it, anybody listening out there today can do it. No matter what it is, we can get to the other side and achieve the best life possible.
And sometimes we need encouragement too. You're doing that with people, because a lot of people may not have that extra. They may say, man, I have a problem, but they need a little bit of encouragement along the way. They can get that from loved ones, but they can also get that by reaching out to you, jflowershealth.com. Not to forget, if you just want to get that tune-up, if you want to find out where we are, and this has been a year of thinking about our lives, about us assessing every aspect of our lives, from career, where do we go from here? Some careers are just going crazy with success, others are not. But a super time, 2020 has been the year of reevaluation. That's what I'm saying. And it certainly is a super time to get the comprehensive diagnosis right here at J. Flowers Health, right?
Yep, it is. You couldn't do it. You know, my whole life, I can remember being a kid going, 2020. We all remember we're thinking about what 2020 is going to be. It's so far away. And what a year it's going to be. What it's going to be, the roaring 20s again.
Flying cars.
Flying cars and spacecraft. Boy, it couldn't be any different. But it is the right time to reach out for help right now. Make 2020, the rest of 2020 and all of 2021, the best year possible for you. And step forward with courage. I always say, have courage, have faith, step out on the plank and walk it with us. And I'll tell you what, we'll get you across the finish line to a better life.
There you go. Dr. James Flowers, thank you for being on the show. Go to jflowershealth.com. Check out the podcast, Understanding the Human Condition. It's all awesome. Thank you so much for being on the show.
Thank you very much. Appreciate you.
It has been said, our health is our wealth. If you or anyone you know is suffering with mental health, addiction, or a complex medical issue, the J. Flowers Health Institute, located right here in Houston, is here to help. The J. Flowers Health Institute specializes in providing comprehensive health and wellness evaluations for individuals who want to improve their quality of life. Every client at the J. Flowers Health Institute receives personal one-on-one concierge service and a workable plan for future health. For more information about the J. Flowers Health Institute and its concierge services, go to jflowershealth.com. That's jflowershealth.com, or call 713-783-6655. That's 713-783-6655. And be sure to mention you heard about them on the Successful Living Show. Again, the number is 713-783-6655, or go to jflowershealth.com.